Thank you, Ebony Waves. Well done. These young, great men and women that are doing wonderful things here. I appreciate you. Good morning, class. Well, all welcome to yet another class today. I'm glad that a lot of us are able to make it already and are here. We still congratulate and salute our Muslim Ummah for successful completion of antenatal class. I can see one or two of them already managed to make it. Today is Salah, but we decided we'll hold our class still. Well, yesterday and today, we're in the festive mood. Yesterday was actually Salah. We don't like starting late. We're a few minutes already behind schedule, so we'll just continue the class. As usual, we'd like to take the second stanza of the national anthem, which is a prayer, and then we'll also take the DIFF anthem, and then later take a song. Is She Not Beautiful? Or Is She Not Lovely? By Steve Wonder. And then I'll introduce the lecturer for today. So please plead with us to be on our feet in honor to our nation. Dr. Barrow, you are welcome. Dr. Barrow, one of our consultants here. Chief Resident is here. I'm here to see the head of nursing and others. Let's be on our feet, please, as we take the second stanza of our national anthem and the DIFF anthem. Ebony Waves.
O God of creation, direct our noble cause, guide our leaders right, help our youth the truth to know. In love and honesty to grow and live in trust and truth. With lofty heights attain to build a nation where peace and justice shall reign. Together bringing hope for the joy of mankind, committed to excellence, home and abroad, motivated we are, together we stand. God bless this legacy. God bless this legacy. Decentralized sectors yet integrated, effective and harmonious workforce we are. Erase modernity, encourage research. God's grace is what we enjoy. More grace to this legacy. United, upholding the dream we all share. We pledge to arise to this clarion call. Our passion, our service to God and mankind. God bless this legacy. God bless this legacy.
Please be seated. Thank you, Ebony Waves. Always very good. I like the way you played that national anthem today, and the man on the drum. I'm saluting you. I give you thumbs up. Thumbs up for all of you. Let's put our hands together for them again. Well done, well done. So, once more, you are welcome for those of you who are just entering and joining us. In a short while, we shall be introducing our guest speaker today. It's one of us again. But before then, our pregnant women are looking very radiant and beautiful. I can see only few men, one or two men that came with their wives. I encourage us, always the invitation will say, come with your spouse. I encourage you to be coming with your husbands, with your spouses, to come and celebrate this great thing we are trying to do here, this advocacy we are trying to promote here. Our pregnant women are beautiful. And so we are going to be singing a lovely song for them. Isn't She Lovely? By Steve Wonder. I invite Ebony Waves as they go ahead with this song.
This is dedicated to you all and to your unborn babies. Good morning. Isn't she lovely? Isn't she wonderful? Isn't she precious? Less than 1 minute, oh, I never thought such love would be.
Let's put our hands together for them. We sure have talents here. These young men and women, including our IT student. Yes, you're welcome, my dear girl. Black Beauty. Please take your seat. They are all our DIFF staff. They work in various departments, including somebody that just came to do IT. She has already joined us in the group. That is very good. We're exhibiting and showing our talents. The same this, sir. Our distinguished students, members of our DIFF concept. I welcome you earlier on. I want to say good morning again once more. Until recently, WHO considered pregnancy as a physiological condition. But we realized that pregnancy has some challenges. There are certain conditions that will make pregnant women, virtually all through the night, I just sleep. I've been in hospital since 5:30. All through the night, I was one call or the other for one thing or the other. All they are pregnancy related. Eventually, we took a delivery around 8 o'clock this morning or so. Dr. Charles, we're adding more babies for you. And now, that's not the topic of discussion. WHO realized that there are conditions that are in pregnancy that can make women have become, instead of having clients, we're having patients. On account of that, the WHO changed the narrative. So we're in a paradigm shift now. Pregnancy is no longer a physiological condition, but it's a disease. And as a result of it, a good disease that you can carry will bring forth a good product. And because of that, some of you may suffer one thing or the other on account of pregnancy. Research has shown that more than 80% of women don't even plan for. They just get pregnant. They just realize they're pregnant. Majority of them are wanted. Majority are also unwanted. So we have unwanted and wanted pregnancy. So it's not good to be having accidental pregnancy because you may be taking drugs. You may be doing some things that you don't know. You may be even having an underlying medical condition. Again, those medical conditions are classified into two groups. There are modifiable ones. There are non-modifiable medical conditions that you can have and can affect your pregnancy or worsen as a result of your pregnancy. Take, for example, sickle cell disease. You cannot modify it. Even though research is still going on that one day we'll have a cure for sickle cell disease. Hypertension is something that you can have, can be control before you get pregnant. Diabetes, so it's if they are modifiable one. There are certain conditions that you may be born with or that are inherited that it will be difficult for us to change. If you go to a pre-pregnancy clinic and you plan your pregnancy, these conditions can be taken care of and will be solved even before or will be mitigated as a result of pregnancy so that it doesn't worsen the condition of your pregnancy. So, in our empowering you and educating you, I understand that some of you complain that we'll be giving some wonderful great women are giving wonderful lectures. Some of you didn't understand some of the things that they were saying, that it was too technical. We have somebody that is very young now to break it down to us today. Another female today. We are lucky to have another female. STEM style research is going on now. You know, when people deliver, they must take a little bit of the umbilical cord and keep it. You can predict how that person is going to be later on in life. And you can also use that thing to cure some medical condition that such people can have. That's how the world is moving away from curative medicine to preventive medicine. And today we are privileged to discuss something that the CMD will come and elaborate more. Preventive medicine. That the world is moving towards preventive medicine. That's why in some countries now, women just get pregnant, plan for cesarean section, go and deliver. That's why cesarean section rate is going up in Europe and so many other people. When I was in Israel, the cesarean section rate is between 80 to 70%. Nobody wants to go and suffer and want to go through the rigors of labor and all that, and the small challenges that goes with it, and you may not know when you are not in good hands. So some women just prefer to just do elective. I plan to have 2 children, all or delivered by cesarean section. This is also a preventive thing. So we have a very young lady today that will be talking to us on antenatal care. Antenatal care as a tool of preventive medicine. She's very brilliant, she's very amiable, very friendly. She's our own Dr. Adetutu Akande. Let's put our hands together for her. This young lady is a graduate of Ambrose Ali University, and she's married. She has a daughter. She's going to be leading our preventive department medicine. Our CMD will elaborate more about her and talk to you about more. Please go to the podium as you get ready. Your slides are ready, I'm sure. She'll be talking to us about antenatal care as a tool of preventive medicine. Welcome, Dr. Akande. Let's put our hands together for her. Don't worry. She's going to break it to your level, and she's very strong. And she told me she's determined to give this lecture.
Thank you, sir. Good morning, CMD, sir. Good morning, DCS, sir. Good morning, my consultants and my colleagues. And most importantly, I want to say good morning to all our beautiful women here and our supportive spouses. You're welcome. I hope that this lecture this morning will help us to understand the basics of antenatal care as a tool of preventive medicine. Once again, I'm Dr. Adetutu Akande, representing head the Department of Preventive Medicine. I will be talking following these topics, starting with the introduction, and then a little note on what preventive medicine entails, its aims, its objectives. Then the nitty-gritty of today's lecture, if you may call it that, antenatal care as a tool of preventive medicine. Under that, I will talk about things like what antenatal care is, how it started, why should you go for it, why is it important. I'll mention some of the objectives, and then how preventive medicine uses it. I would also talk about things that you would expect when you come in, anytime you come in for antenatal care. I would like to highlight some examples, and then I will conclude. By way of introduction, preventive medicine is the practice of promoting health, promoting good health care to improve patients' well-being, and ultimately to prevent disease, disability, death. According to the World Health Organization, when we talk about antenatal care, first of all, World Health Organization reported in 2015 that about 303,000 women died yearly in a study that was carried out from 1990 to 2015. Yearly. Imagine that heavy number of women passing on because of pregnancy or its complications. And it says in that study that most of them, like about 99% of them, come from developing countries. And about 66% of them come from the West African region, followed by Southern Asia. It has, well, when I say it, I mean maternal mortality, or should I use the word maternal deaths, has a heavy adverse effect on on many levels. It affects children. A woman was pregnant, had complications, she died as a result of this, or developed some really serious illnesses or diseases as a result of the pregnancy, and is no longer with her family, or the family members do not have her. The children she left behind are going to suffer. The family, the household she left behind will definitely suffer. I mean, when we were growing up as children, even me, I'm still young, we go home, we come to meet mom. When I run home, my little girl is always happy to see me. She tells me things like, I'm hungry, I'm hungry, I'm hungry. only a mother is there to ensure that things run in the household well. And then when mothers die, households suffer, children suffer, and then ultimately the society suffers. The children she left behind, there's nobody to raise them up to become ideal citizens of the society. So that's why this topic is coming today. Preventive medicine deals with health promotion and disease prevention through population-based interventions. What it's saying here is, okay, let me finish this. It says, including action to address social determinants and health inequity. So what it does is, it reaches out. It has a very wide reach. It reaches out to every single person, but it deals with populations. It deals with large numbers of people. It deals with countries. It deals with, ultimately, the world. But it reaches every single individual. That is what preventive medicine does. It prevents illnesses. It prevents diseases. It prevents sickness. It helps, it ensures that for a pregnant woman, her pregnancy goes on as smoothly as is possible. The aim of preventive medicine is the absence of disease. Like I said, it sounds like tautology, but I think the more we hear it, the more it will sink in. Preventing the occurrence of a disease or halting it. You just find out that something is coming up in this pregnancy. Dr. Osman mentioned sickle cell disease. Maybe a person gets pregnant and she already has sickle cell. We're trying to make sure that we are working to ensure that these women don't have complications, that the sickle cell disease does not adversely, adversely affect her, affect the pregnancy or its outcome. So that's the aim of preventive medicine. When we talk about aims, it's like the general goal. When we talk about objectives, how it goes about doing that. In the end, it's to prolong life and reduce disability. Some people, as a result of pregnancy, have issues with maybe being able to stand up because of where they went to go and do their antenatal and how they deliver that child. Different stories here and there. So now, talking about antenatal care as a tool of preventive medicine. First of all, I'd like to define it. Antenatal care can be defined as the care provided by skilled healthcare professionals to pregnant women and adolescent girls, those girls that Dr. Osman mentioned unwanted pregnancies. Adolescent girls also get pregnant, so they are also included in this care in order to ensure the best health conditions for both the mother and the baby during the pregnancy. How did it start? It was first introduced in 1900 to the United States, and a study came up about 14 years later, which showed that there was a reduction in the number of deaths. This time around, not just for mothers, also we talk about the babies as well that they give birth to. The study showed that there was a reduction by 40% in the number of children that die yearly as a result of deliveries. Maybe the deliveries didn't go well. As soon as antenatal care was introduced, just 14 years, 40% reduction. That's very significant. In 1950, another study was done by Merckart, and it showed that antenatal care was the single most important reason why there was improved maternal health during pregnancy. Antenatal care contributed so much significantly just in a short period of time to the outcomes, the health of the pregnant women. By 1980s, about 75% of women in the US have started going for antenatal care right from the first trimester. That's from the very first 3 months. They had already started running to the clinics. Oh, I'm pregnant, please, I need a doctor to see me with the other healthcare professionals. I need to make sure that they watch me during this my pregnancy so I can have a good outcome. Because people themselves were beginning to see the effect of antenatal care, how it was able to prevent all these diseases and complications that arise from it. At the same time, in England, in the 1900s, it was also introduced. They also reported the same kinds of figures. In 1950 to 1960, thereabout, it was introduced to Nigeria by Lawson and Stewart. And we can see from there that antenatal care became better. There was improvement in the pregnancies of people within the Nigerian system. So, all these things I've said, I bet if I asked anyone here, why should you go for antenatal care? I'm sure that with the things he said and I have said, we can say so many things about why antenatal care is important. But I will still reiterate, is to ensure that every wanted pregnancy results in the delivery of a healthy baby without impairing the mother's health. So the mother goes through pregnancy as healthy as possible, delivers a healthy baby, she finally gets to go home, the family gets their daughter back, the children get their mothers back, the husband gets his wife back, and life proceeds. The society is blessed. That's why antenatal care is quite important. Antenatal care has objectives. It promotes and maintains physical, mental, and social health of the mother. We talk about physical. Every time you come for antenatal, we always do what we call vital signs. We check you. We ask you to do a analysis test. We ask you to do some other tests like that. The physical. When you come in, we ask you, how have you been? Your mental health. You understand? Your social health. Oh, you're having this challenge, you're having that challenge. We try to talk with you, see ways to help to ensure that even the social aspect is affected positively. And also do that, also ensure that the babies themselves are healthy ultimately. We provide education on things like the nutrition, personal hygiene, and of course the birthing process. I will talk more about that much later. Antenatal care detects and manages complications. Sometimes, I don't know if you've heard of things like gestational diabetes, heard of preeclampsia, and you wonder what is that? Antenatal care not just tells you what it is, but also manages it to ensure that the mother at the end of it is healthy, comes out well, the child also comes out well. And antenatal care does this. Sorry, I'm saying antenatal care, but I just want you to know what I'm talking about. It does this either maybe doing what we call medical interventions, as maybe we need to use drugs to do this, or we have to do surgery to ensure this, It helps also by ensuring birth preparedness. Many times people tell you, oh, I've delivered all my babies, this one I'm going to deliver that's vaginally. But things will crop up, things that you don't expect. As they crop up, within the clinic visits, we are able to catch these things. And your carer tells you, okay, based on what we see, based on the trend, on how we have been able to manage and follow up on you, this will be the best line for you. This will be the best treatment for you. in terms of how you deliver this particular child. Some people, let me just give an example here. Some ladies are not so tall in height, physical height. They're not so tall, or maybe their hips. I'm trying to break it down to make it very simple. Maybe their hips are not as well developed, probably because of how they grew up. You know, when they were growing up, the kind of nutrition they had and all of that. So it may not be wide enough to allow a child to pass, or because she's not so tall, there will be issues if she tries to deliver by herself. That's what I'm talking about when I say birth preparedness. Such women, we counsel them in antenatal care. She's counseled. You need to, this will be the best option for you. We're not saying totally that everybody must go through a particular way of delivery, but when we see all these risk factors, all these things that could either cause injury to the child or injury to the mother, we'll tell you, based on this and this, this is the best way to go. If there are complications, we have a readiness plan, especially here at DIFF Medical Center. When complications arise, there's always a plan. We are not just, as the complications arise, we begin to wonder, oh, how do we do this? No, we are ready. We know what to do per complication. As it arises, we know what to do. We have a team of well-seasoned consultants, not just in the field of obstetrics and gynecology. We have pediatricians who take care of the children at whatever age they are born. We have other departments like the cardiologists, the endocrinologists. They all come together. The surgeons, they all come together to ensure. We have nutritionists. They all come together to ensure that if complications arise, if it is their area of specialty, they come in and ensure that the outcome is in favor of the mother and her unborn child. The antenatal care doesn't just end there. We go further to prepare mother in terms of breastfeeding the children successfully. When I first, while I was still in school, I remember one time like that, one of the nurses came and we were having rounds and told me I should tell this woman how to breastfeed, and I was wondering, what is she saying? Is it not just to put a baby like this and just start breastfeeding? But she began to highlight how to position the baby in their arms. You should sit straight. You should bring the baby close to you. You shouldn't go to the baby should come to you. She broke it down. That is what antenatal care helps to do. It's not just put the baby to the breast and that is it. There are some other things, and the nurse taught me. And now, when I'm also part and I get to see women, I also tell them, our antenatal care here ensures, we have we have rooms called rooming in here, where women are taught how to breastfeed. That's still part of the antenatal care. It says here, like I highlighted here, experience normal puerperium, the big word, but what it means is that period after she has delivered. There are things that could also happen there. Antenatal care ensures that those things too are dealt with. It says, and take good care of the child physically, psychologically, and socially. That's what the antenatal care does. Preventive medicine uses antenatal care. I have already begun to speak about this topic even before getting to this slide. Antenatal care helps to detect and treat complications. By treating complications, it prevents adverse outcomes. It helps to identify women who are at risk of developing complications during labor, during delivery. I already explained that. And should a person require referral to another specialty, preventive medicine uses antenatal care to do that. It provides an opportunity to prevent and manage diseases. Some women may have had high blood pressure before they got pregnant. Antenatal care integrates other specialties in. On its own and with other specialties, we manage high blood pressure, we manage diabetes, we manage sickle cell, we manage asthma, we manage whatever issues crop up. Antenatal care does that. So, how often should you come in? WHO first brought the focused antenatal care, which involves 4 visits. But one thing about WHO, when they bring something, they also follow up on it. And when they followed up on it, they realized that just coming to the hospital 4 times in those 9 months still had a lot of issues. There were a lot of stillbirths rising up. And so they decided to change it and increase the number of visits to 8. As the 8 visits in antenatal care started, there was better outcomes. Remember, I said earlier, 14 years after they introduced it, 40% of children, there was a reduction in 40% of children that normally die every year during delivery. But here, in fact, they said something. The more women come for antenatal, in that single pregnant antenatal care visit, the more they come, the quicker we can detect issues, health concerns, the quicker we can detect social problems, physical problems, whatever it is, the sooner we can address them and follow up on them for a better outcome. Here at DIFF Medical Hospital, we even go beyond that. We don't just do 8 visits, we do more than that. Sometimes we do twice weekly. From the first time you come. Sorry, I said twice weekly, I meant 2 times in a month, every fortnight. We come in 2 weeks as against coming 8 times in the entire pregnancy. That helps to ensure a better outcome for the mother and her unborn child. But there is a downside to that. The more you come, there's a burden. However, here we have enough hands, enough brain power, enough experience to ensure that we are not overwhelmed by the number of times people come in for antenatal care. When you come in to the antenatal care, what should you expect? Expect effective communication. We'll talk to you one-on-one. You talk to us, we discuss, we liaise together, we agree, and we move as we go along. You expect topics. We can talk about nutrition, we can talk about maybe the symptoms that you're experiencing and why you're experiencing it. We can talk about how to promote your health in this pregnancy that you're carrying. We can talk about the unborn child and what you should expect, how you should go about it, and all of that. You expect also when you come here that you will be examined. Definitely, you will be examined. We will examine you to ensure that you are doing well, that the pregnancy is progressing as expected. And then we will carry out tests on you. If issues arise, you should expect that we would intervene, not in a delayed manner, but we would intervene on time. So that's timely interventions. And if you require extra expert management, we have consultants on ground who would also be available to see you, to co-manage with us. So these are examples, just like a little table. I don't know if it is clear from your view. I'll just quickly go through it. At the first visit, we'll take your bio data. We want to know your name because you are unique, and we will not mix your details with any other person. We want to know your age. There are certain issues that arise depending on your age. We want to know what you do. Some people, while pregnant, cannot do certain jobs. We want to know when you saw your period last. Every time we ask you when you come, when did you see your period last? Because it helps us to know when you should deliver. We ask about things like your health, any health conditions you had in the past, or if you've had any surgeries before, what kind of surgeries it was, how you fared during the surgery and after the surgery, if there were any issues. We asked about things like if you smoke or you drink alcohol, or if you take other substances. It is necessary. It's not to insult anyone, but it's so necessary because we need to know how to manage you and your health to ensure that you are healthy, the pregnancy is progressing, and the child comes out healthy. So that is done at booking. We talk about your nutrition as well, so that you can stay healthy and keep a healthy weight. We talk about the kind of supplements you take. If you notice, most times you are on things like pregnant care, Oberon 6, ferritin, ferrous sulfate. All these are to ensure that you don't develop complications like anemia in pregnancy. Sometimes too, you see, we give you things like calcium. Calcium reduces the risk of preeclampsia. So we talk about nutrition, we talk about supplements. Sometimes too, when we are talking with you, when we are discussing antenatal care, we want to know your social state. Some people are going through a lot within their pregnancy. And we care for you, not just for the pregnancy alone and the physical health. We talk about your mental health. We care about how you are able to manage the pregnancy in your mind. We talk about your social well-being. And we help to profile solutions. We examine the examinations that we do. We have the vital signs, like I mentioned earlier. Your temperature, your pulse rate, your blood pressure, your respiratory rate, the SpO2, that's the percentage of oxygen in the blood. All these help us to detect if there are issues. If there's any derangement, we address it immediately. We do your general test to help us see whether you are pale, maybe your blood is low or something. It helps us also still to detect diseases or illnesses during pregnancy. There are specific examinations that we do in antenatal care. Simple things like the fundal height, how big is the pregnancy going in relation to the age of the pregnancy. That helps us to check if the baby is doing well. We check, if you notice, we do a lot of scans as well. We want to check whether how the baby is doing inside, what's the heart rate like, all of that. Sometimes, depending on individual pregnancy, there might be other illnesses. It may require a cardiologist oversight, it may require endocrinologist oversight. We also have specific examinations that they may want to do for you. So these are things that you would have when you come for antenatal. This is table here. This is just one or two examples of things. So I want to highlight, first of all, malaria in pregnancy. We are in West Africa. Malaria is endemic here. And people just feel, it's not just malaria, it's not just malaria. But let me just use this opportunity to tell you what malaria can do. First of all, it can make the mother's blood level very low. That's one. It increases the rate of miscarriage. It can cause intrauterine, that's while the mother is carrying the baby, the child can die. It can cause the woman to go into preterm contractions. That's before the 40 weeks, the woman starts having contractions. It can cause the woman not just to have preterm contractions, but to deliver at that early time. It can cause the child that is born to be small, to have a low birth weight. So those are things that malaria in pregnancy can cause. So it's actually important to deal with it. And in our antenatal care, we have measures to prevent it, called the intermittent preventive treatment. We use Proguanil. I don't know how many of us know the drugs that we are taking. Proguanil is used to prevent malaria in pregnancy. Some other drugs that could be used as well is Fancida, but we prefer Proguanil. It's easy to tolerate. Women take it without problems. Another thing I want to highlight here is, I know how many times I'm in the hospital, women come in and they are not too happy that they have to be injected with tetanus. But that tetanus injection, I see somebody smiling, that tetanus injection is to prevent that child when it's born from developing complications as a result of tetanus. It's really, really, really a serious thing. It can actually cause a child to die. So we give you tetanus injections in your pregnancy. Of course, that's depending on how you received your injections before. There are other things. There are other things. For lack of time, I don't want to go into too many of them. But these are some of the common things that we deal with here. That is how preventive medicine uses antenatal care to prevent problems in the health of the mother and also of the child. In conclusion, attending antenatal care offers everyone, let's just put it as everyone, because every level is involved. The pregnant woman, her family, the society, the healthcare providers, the government, everybody is involved. So it offers an opportunity for the prevention or the reduction in the occurrence of the number of women that die. It prevents illnesses or manages those illnesses within the pregnancy and provides chances. If you look at my slide, if you can clearly, I highlighted chances. Every time you come for antenatal care is a chance to prevent something. So it provides chances for health promotion and dissemination of information about danger signs. When you go home, I know some women that came, oh, my baby is no longer kicking like it used to before. It's no longer, so we check you, we scan you, we do all the necessary things, and we update you on what, if it is nothing, or if it is something, we tell you. That is what antenatal care offers to you. Among other things, I will say, like knowing how you're going to deliver and why. And of course, if you need other specialties to come in to manage you as well. Thank you very much for listening.
Thank you very much, Dr. Kande. Please take your seat. Take your seat. CMD will come and elaborate later. Let's put our hands together once more for Dr. Kande. She did very well. The young shall grow. I told you, some people are complaining that the last 2-3 lectures, maybe they are loaded, but she simplified it and went as much as possible to our level. Well done, Dr. Kande. Good. This my daughter will do better in future. She mentioned something that's very important. Population intervention. I want us to really catch it. That's what we are doing now. You are all our advocates. You are the one that will be going to promote this thing for us. The Society for Obstetrics and Gynecology in Nigeria, called SOGON, UNICEF, is working all over this country in conjunction with Federal Ministry of Health and other healthcare providers in the states and local government level to reach out to our women. Our antenatal care attendance is less than 30%, maximum 35%. We are advocating. You are advocates. You are supposed to go and promote this thing. That's why we're empowering you. We are teaching you. Up till now, our antenatal care attendance in Nigeria is below 50%. It's very sad. It's very, very sad. That's why our maternal mortality. She talked about mortality. Some of these things are poor in Nigeria. For every 100,000 women that deliver, about 1,000 will die. Why should our women die? People who have attained this level of preventive medicine, they have zero maternal mortality. So she has talked about that mortality. It's very key and important. Yeah, we gather women. They say come for theater class. You gather women, they clap and sing, and those dance and those disappear. You are not empowered the way we are empowered. Look at the various specialists. The last 3 or 4 lectures that we've had, various specialists teaching you various things about preventive and medicine and how to protect and keep yourself. So it is very important for you to understand the difference between class and care. When you come to care one-on-one with your doctor, some people just don't even want to come to this class. They feel I've delivered 2 or 3. We are still learning. We are still learning with all our years of practice. You know, we are still coming. We are still learning in this class. I learned a lot from this, my young daughter today. She's doing very well. So come to this class, come for your care. You have weekly visits. One woman had a problem. She had a pregnancy in US, delivered in US, developed severe preeclampsia, had the baby and died in US. Somebody told her, come back to Nigeria. Nigerians are doing well. Landed with me. I saw her 32 times in her pregnancy. I sent her back to US. When the doctor saw the report, she delivered eventually. The baby is around, it's 5 years. She had another pregnancy, she had a set of twins. All, we took care of their pregnancy in this place. Our doctor told, this is your doctor, tried for you. Saw you 32 times. So there are patients, some of you here, we see you on a weekly basis. Some of you, we see you every 2 weeks. We don't joke with antenatal care. You cannot go through antenatal care here and not be seen a minimum of 12 times. It is critically important because we can dictate things and pick them easily. Anyway, start coming up. Come and give us a song so that this knowledge will sink. Head nurse is already taking questions all around. So we're going to listen to a song by Ebony Waves. So it's critically important for you to both attend the care on a regular basis and come here. No mother is experienced. Even if you have 10 children, you are not experienced. You are still learning. We are 35, 34, MD is 37, 35, 35. We are all still 30. We are still learning. We are still learning and we'll continue to learn to ensure that we empower you correctly. The use of, some of you don't like taking anti-malaria. We have Federal Minister of Health and WHO say that because we are rural people, poor people, they recommend that fancy that you are mentioning. That's what you use for intermittent preventive therapy. That should be given at least 2 or 3 times in pregnancy. But also know the complication of that drug, that fancy. You can't give it before 16 weeks. You cannot give it close to delivery. So here, we have international global patients. Some of you are Ajabota, some of you will go out to deliver and all that thing. That's why we are giving you Proganin. Proganin is daily, while Fancida is used as an intermittent preventive therapy. Give 2 or 3 times maximum in pregnancy. So you have to understand and appreciate that. So on that note, I want to say, give your questions. I'm sure Dr. Kande is ready to answer your questions. Dr. Dausa is here to help. Our another chief senior consultant here, Dr. Barra is here. The pediatricians are here. Chief President is here. So we're all here for you. Eventually, Dr. Dausa will come and round up for us. As we listen to this song again, how are you, my friend? Our women are lovely, they are beautiful. So I want to say, how are you, our beautiful wives and pregnant women? Ebony Waves.
Yeah. Kajo, 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 kayo, kayo, kajo. Uyo me ole ho so komi oi. Uyo me ya, uyo me ya. Oh, uyo me ole ho so komi oi. Uyo me ya, uyo me ya. Oh, uyo me ole ho so komi oi. Everybody's born a winner, yeah, yeah. If only you just believe it, yeah, yeah. Close your eyes and come and see it now, yeah, yeah, yeah. Don't you worry about the thing now. Cause if you work hard, you can get it if you want. If you strive hard, you can be just what you want. If you work hard, you can climb the mountaintop. Cause nothing is too small and nothing is too big. Oh, Uyomea, Uyomea, oh, Uyomea, Lehuosa, Kami, Uyomea, Uyomea, oh, Uyomea, Lehuosa, Kami, for me, say I never call you sins, but I hope that you are well. I hope your market every day I pray for you. Make Baba God bless you. I never forget you. How I go forget you. See my shoulder, make you rest up on it. You know I got you. Me be your friend indeed. The money don't show now. I don't keep some for you. You know cause all around. Cause everything again now for me and you, yeah. How are you, my friend? How do you do, my friend? I know sometimes it be like say nobody's in you. That's when the life I did for you, my friend. How are you, my friend? How do you do, my friend? I know sometimes it be like say nobody's in you. That's when the life I did for you, my friend. Oremi Atata, you always in my mind. Jimmy gone, gone, gone. I cherish you with my life. No worry yourself, everything gonna be alright. And if anybody try you, God's gonna be on side. See my shoulder, make you rest up on it. You know I got you. Now me be your friend indeed. Oh, money don't show now. I don't keep some for you. You know cause I'm around. Cause everything again now for me and you, yeah. How are you, my friend? How do you do, my friend? I know sometimes it be like say nobody's in you. That's what the life I did for you, my friend. See my shoulder, how are you, my friend? How do you do, my friend? I know sometimes it be like say nobody's in you. That's what the life I did for you, my friend. Come on.
Thank you, thank you, thank you. I don't know, maybe I'll tell my wife after 4 children, whether I should have another 10, I invite these people to come and sing for me and celebrate a baby. A baby is hungry when I hear these people. So if you catch these people to come and sing for you when you have your babies. But most importantly, our wife, you are lovely, our dear patients. These people are available. You can take them and you can use them for your events. This hall is also available. The managers are behind there. Promise, raise your hand, let them see you. You are the leader of this group. You can contact him in case you want to use them for any event here. So women, drink your water, or you have water, straighten your legs, move around. We don't want you to sit for too long. Head nurse is ready to take all the questions and answer at the end of the day. CMD will round up. Where we need to intervene, Dr. Barrow is here. Chief Resident is also sitting by you. Dr. Olonam, the head of pediatrics, is also here. We are all here to assist you and to buffer you. Don't worry.
Thank you, sir. Good morning, CMD, sir, the DCS, Dr. Barrow, our ESCPC, and our beautiful presenter, Dr. Adetutu. Thank you very much. And good morning, our ladies and gentlemen. We have some questions here. Somebody wants you to throw more light on birth preparedness. Then someone wants to know more about after effects of epidural management. Then someone asks, I want to know the best sleeping position in pregnancy. Another person asks, does anti-malaria preventive medicine have impact on child immune system after birth? Then how often is a pregnant woman to take, how often is a pregnant woman to take progenyl throughout the pregnancy for prophylaxis? Then I have 2 more questions here. Purging in pregnancy, is it a thing to be worried about? Then what are the... Okay, before we continue, because we still have 3 more questions. Okay, let me read all. What are the things or complaints that should prompt a pregnant woman to call her doctor? Then somebody asks again, at what point are the expectant mothers taught how to breastfeed? Then another question says, are additional supplements like pregnant care required aside the drugs we connect during our antenatal visits? But pregnant care is part of our routine medications, actually. Thank you, sir.
These questions are loaded. There's no better person than the chief himself. The chief medical director will just start. If you have further additional questions, better give them now. As Dr. Dawsa will be talking a little bit, elaborating on preventive medicine. But he will also zero down on this question. He's the chief. All of us have grown, all of us have become chief. But he's the chief about the chief. So he's emeritus chief consultant, obstetrician and gynecology. He will help you to answer this. Maybe you allow you answer 1 or 2. But he will just start with his roundup comments and he will now elaborate on these questions. I have them also with me. Maybe you need to chip in and add something. The floor is open, sir.
Baraka de Salah. And I hope I will give you your Salah. I'm sure after now some people will, after the class. Welcome to today's antenatal class, and thank you, Dr. Adetutu, for your presentation. And thank you, students, for coming in spite of the Salah period. We had wanted to shift this class in honor of our Muslim clients, but it struck us that it was already too late before we knew that the Salah was going to be falling on a time like this. We thought it was going to be one day ahead. So if not, would have pushed this class so that you can be at home. Thank you, Dr. Adetutu, once again, and thank you, our Director of Clinical Services and everyone present. There are people who appreciate the value of preventive medicine. You are going to be at the Italian Embassy, I think in 2 weeks' time, to address the ambassador and the Nigerian, or the staff of the Italian Embassy on the value of preventive medicine. You know, those ones, they call us yearly. We tell them the light they should use, how they should sit, vaccines that must be used, because they know that prevention is better than cure. They know that the sentence of death or morbidity can be mitigated. But for the average African man, he thinks something must kill a man. The white man feels it's not like that. Some deaths are preventable. I'm going to piece it together for you and attempt to answer those questions too. The pregnant woman is a fourth person. That's why Dr. Osman started by saying that you no longer just say antenatal or pregnancy as a mere physiological event. No, you are a fourth person with a unique condition that must be taken into consideration. You are not a man. You are not the normal woman. No, you are not. You are not a child either. You are on your own. This is because there are certain things that happens only to pregnant women. That's why we're talking about antenatal. Gestational diabetes happens only to pregnant women. Pregnancy is a diabetogenic state. In other words, even if you didn't have diabetes before, because you are pregnant, you can become diabetic. Pregnancy is the greatest stress that a woman's body is put through. It's good you know, okay? There's what they call gestational hypertension. In your family, nobody is hypertensive. But simply because you are pregnant, you become hypertensive. It's pregnancy that causes this. The third thing that is peculiar only to pregnant women is called the carpal tunnel syndrome, where suddenly you begin to put so much fluid and you can no longer hold things tight. You are having tingling sensations on your fingers. Your hands are weak. And some of you, if you are not careful, it can even affect your facial nerve, and you have what looks like a facial paralysis. But after pregnancy, it comes back. It's pregnancy that is causing it. Some of you seated here have leg swellings, hand swellings, abdominal swellings, facial swellings. You are puffed, you are full of water. Pregnancy. So the pregnant woman is a fourth person. The problem is that what looks normal can suddenly gravitate into abnormality. So the margin between what appears pregnant and what appears normal is so slim that if you assume that it's okay, the next thing is mortality. I'll still tell you the other things that only pregnant women have. But let me tell you that medicine has shown that if you take 100 women, how many of them really needs to see doctor? How many? That if they don't see doctor, mortality is waiting for them, or morbidity. Actually, maybe only 2 out of 100. The problem is that, who are these 2 people? The only person who knows these two people is God. It is because of these two people all of us left our houses today. Because I don't know who they are. And those people, the time we'll be knowing them, mortality has occurred. The death of a pregnant woman before, during, and after delivery is an anathema. It should not happen, but it happens. And unfortunately, there are 3 countries where it is still said you should never be pregnant in or deliver in. The first one is Pakistan. The second one is Afghanistan. In this whole wide world, the 3rd country is Nigeria. With the great resources that we have. Whereas 100,000 women will go through antenatal in the nation of Finland, Denmark, Sweden, Norway, the Switzerland. These countries that are termed the happiest countries in the world. You know why? There is no maternal death. There are some countries in this world that nobody is buried in one day. In Nigeria, for every 100,000 women that goes through pregnancy, in the process of delivery, we lose more than 1,000 of them. That's an anathema. The reason it's happening is ignorance and poverty. Things that are unique to pregnant women. You are putting on weight. A lot of you here will put on weight, nothing you can do about it. And you're going to put on close to 18 kilograms. But luckily you are going to lose them. Because the baby contributed 3.2 kilograms, which will be dropped. The placenta contributed 1 kg. The amniotic fluid contributed 1 kilogram. The uterine size, your breast, water, blood, and all those things. But why are you putting on weight? That's why they sang for you, you are a beautiful woman. Only pregnant women are really beautiful. The reason why pregnant woman is a 4th person and there are diseases only you can carry or is common amongst you is called the deep vein thrombosis. Pregnancy is a thromboembolic state. That is why we don't allow women or we don't encourage women to wear tight things around themselves. Please don't cross your legs like I can see some of you are doing now. Pregnant women don't cross legs. When pregnant women are sleeping, you put pillows between their legs. No. Pregnant women are shifted. What's the best position to lie on? Shift on your left side. It's the husband's job to put pillows behind. Somebody will say, husband that is snoring. Abi, it's me that will put pillow. I'm the one to put pillow behind you. What is it? Husbands, please be awake. Put pillow. Shift. It's for your baby. Shift to the left side. 80% of the time, lie on that side. The remaining time, lie on your right side. Then sometimes you can lie on your back. But most times, always shift. The reason is we are pushing the baby away from the aorta, the big vessels. Only pregnant women have skin changes. Whether you like it or not, whether you are fair like me, or you are black like Dr. Usman, some skin changes must take place. One of which is called the linea nigra. It's going to take place. The second one is called the cloasma of pregnancy, the face mask of pregnancy. It's going to take place. And then you're going to have the stretch mark called the trigravidarum. Please don't try to bleach it. Just leave it. When you deliver, it will reduce, but it will remain as a memorial, an evidence that once upon a time in your life, you carried a baby before the 28th, after the 28th week of pregnancy, beyond 28th week of pregnancy. So when your child talks to you anyhow, or your husband tries to mess up with you, just show her, show him the linea nigra. It's only pregnant women. Pregnant women, you can easily have hemorrhoids. You're going to pass through, suddenly you are seeing blood coming out from your anus. Please don't get worried. Don't attempt to do anything. It will go back. Pregnant women are the ones that have reduced immunity. That is why you are susceptible to malaria. It is thought that women who are carrying pregnancy for the first time, between the 28th and the 32nd week of pregnancy, you will have malaria. So answer the question, does taking the malaria prophylaxis prevent malaria? The answer is no. It mitigates the symptoms and the severity. Because if you don't take it, not only can you have malaria, you can even pass the malaria parasites to your unborn child. I'm sure you don't want to give birth to a child already having that. So pregnancy is a stressor. Husbands, we, Dr. Usman, myself, Dr. Lona, Dr. Bara, all of us, we are stressors. We. Please don't stress the pregnant woman. I beg you. It's enough of the stress. So antenatal care has 5 components. As a preventive tool, has 5 components. Component number 1 is called education. This is what we've just done today. It's a means of empowerment. We want to empower you. Because the reason why the tiny woman in the tiny state of Finland will not have maternal mortality is information. If you want to change what people are doing, change what they know. The difference between individuals is all about information. So component number 1, education and counseling. Component number 2 is called clinical surveillance. It's antenatal as a preventive tool. Clinical surveillance. When you have a pin inside a tipper load of sand and you are asked to pick that pin, you have to scatter the sand carefully. There are some women that are going to be diabetic because they are pregnant. It is my job to identify them. It is in the course of doing the clinical surveillance, we categorize women into low risk, medium risk, and high risk people. Then the third component is called the clinical care. Dr. Adetitu told us when antenatal started and while we're in the medical school, you are taught to come to antenatal care once before the 28th week, once a month. Between the 28th and the 36th week, twice a month. And after the 36th week, weekly. There are some of you we see every week. Not because we like to see your face, but because we know that a stitch in time will save 9. So clinical surveillance. We need to know what's going on. The third component is called clinical intervention. How will you have a girl who has sickle cell disease and not see her often? How will you say a woman who has diabetes before pregnancy, or a woman who is hypertensive before pregnancy, you do not see her often during pregnancy and intervene when necessary? You're going to have morbidity and mortality. The thing about Nigeria is when somebody dies, those of you who come from where I come from, we say the devil has done his worst. Those of you who come from where Dr. Usman comes from, we say God has had his way. Let me tell you something. It's not the devil that did his worst, nor God that had his way. It is ignorance and poverty that did his job. In other words, give me 1,000 women, irrespective of their clinical condition, who will attend antenatal care and go through all the components. We will return that 1,000 women back to their families. I'm telling you. In other words, in this day and age, no woman should die because she's giving birth to another. Your life should swing between life and life. There is no place between life and death. I might not be able to prevent the workings of demons, but we have what it takes to make sure that no woman is killed in the course of pregnancy and delivery in this hospital. We have what it takes. We can deliver that expectation, and we can give fulfillment to that promise. That's why we're here. The fourth component, to ensure you go through proper puerperium. In the northern part of this country, maternal mortality is contributed significantly to by women who use hot water bath, because it is considered that when a woman delivers, she should drink hot tea, she should drink hot pepper soup, she must eat hot things containing cow, must eat hot things containing potash. She must have a hot bath. To even make matter worse, they use the hot thing to press her body. So they die from cardiomyopathies. Mothers who are here, wives, husbands, please take charge. If your mother-in-law comes and wants to use hot towel to touch your wife, tell her, Mama, no, you can't do that. Your wife will not be able to say it to her mother-in-law. But husband can say, don't touch my wife with anything hot. Who said it? Tell them you met a doctor who graduated 37 years ago, who has seen more than 50,000 women and has what it takes to speak as an authority in the field for which I have been trained and I have practiced. Those who agree with me say yeah, and those who don't agree say nay. The years have it. Well, the purpose of antenatal care. There are women, it's time to prepare you for the puerperium, to ensure you have a proper puerperium. A pregnant woman is still pregnant until 6 weeks after delivery. If you are taking pregnant care, you take it 6 weeks after delivery. If you are taking Proguanil as a malaria prophylaxis, you take it 6 weeks after delivery. Women, there are some women who are going to convulse, who are going to have hypertension in pregnancy at about the 15th day after delivery. The pregnant woman is still pregnant until 6 weeks after delivery. It is because everybody laid down their guards. That is why you see women develop eclampsia within that first 15 days of delivery. Once a woman has developed eclampsia, in other words, you convulsed during pregnancy or during delivery or after, you have lost 30% of your brain power. You are a candidate for dementia. You are a candidate for Alzheimer's disease. You are a candidate for Parkinsonism. You are a candidate for renal disease. You are a candidate for anything bad. The only way to prevent it, please keep yourself close to us until 6 weeks post-delivery. The first component of antenatal is provision of immunity to the child. That's why you come for antenatal. Therefore, you must take your tetanus toxoid injection and other immunity. Let me tell you, distinguished students, that when you come for antenatal care, it is important for us to test your urine. But some of you, by reason of the way you padded yourself, it is not easy to give your urine. Maybe Dr. Osman will see you, maybe Dr. Barra will see you. I will not see any woman who does not do a urinalysis and asks me for antenatal. I can't do that. Because if anything goes wrong, my certificate is put on the line. Who was the last doctor that saw? In order to make things easy, when you are coming for antenatal, please boo-boo. Where it is just easy. Actually, my recommendation is wear the same dress each time you come for antenatal. At the University College Hospital in Ibadan, where I did my basic training, when we want to take your weight, you pull off your clothes and wear a a theater gown, so that it will be the same weight. Because 0.5 kilogram difference in your weight between last week and this week can predict whether you are going to have pregnancy-induced hypertension. I can predict it. So what is wrong in putting on the same dress every day? Every time you are coming for antenatal, who is looking at your dress? That's my recommendation. There are some women that must do this. Whenever they are coming, they must do it. Who are these women? Women who are below 18 years and women who are carrying pregnancy after 35 years. Women who are carrying more than one baby. If you are carrying twins, triplets, quadruplets, this is important. Women who are carrying their pregnancies and women who have delivered their fourth baby and now they are on their they're carrying their fifth baby. This category of women, those ones who have delivered 4 babies, they come as gurus. They tell you they have experience. When you are talking to them, they say, my friend, I delivered Joshua in 1944. I delivered Barao in 1946. I delivered Ulonam in 1947. I delivered Akonde in 2010. Nothing happened. Nothing happened. These doctors, they do talk. Those guys, those women, they are so confident. That brings me to the question of birth preparedness. You prepare for war at a time of peace. There are some women who should start preparing for pregnancy before they get pregnant. How can you be an SS and not start preparing for pregnancy at least 6 months before time? How can you be above 38 years and not prepare for pregnancy? By taking the multivitamins, because you don't want to enter pregnancy in a deficit state. So you begin to prepare, because the pregnant woman is a fourth person. Oh, the woman already has a slip disc. You are always having back pain. During pregnancy, back pain is going to increase. Why will the back pain increase? Because you are pregnant. That's why you are having back pain. I hope nobody is wearing high heel here. Those of you who are wearing high heel, your back pain will be worse. If it doesn't happen today, wait for it in 2027. Wait for it in 2028. Pregnant women are not allowed to wear high heels. Well, you may say that I'll go and deliver in the US. If I deliver in the US, I will be safe. It's a lie. I sent a very top staff of the Central Bank of Nigeria, on whom I did a procedure. And I gave a letter. Please, this pregnancy must not go beyond 32 weeks. Those doctors in the United States operating under the delusion of having or being in the US allowed this woman get to 34 weeks. Me that did the surgery, I said, don't allow. You that did not do it, you are proud because you are in the US. Let me tell you. Doctor, I have done more surgeries than an average gynecologist in the United States of America. I'm telling you. That's just how it is. And then, immediately the baby was born, the father called me. 1 hour later, he called me that my wife is dead. Okay. Last year, we admitted a woman upstairs who had taken a delivery in the United States and was having rectovaginal fistula. In other words, she was passing feces from the vagina. Therefore, those of you who are going to be delivering outside this country, there are some basic questions you must ask. It's preparedness. It is not because it's in the United States, then it's better. This hospital with the team of gynecologists is better than many hospitals in any country in this world. I'm telling you. Because we bring the power of our corporate experience. You must ask, does this hospital have a blood bank? Who is the gynecologist? I attended a meeting of the American Society of Reproductive Medicine, and the president of the American Society of Reproductive Medicine mentioned that a time is going to come, and a time has come, when there will be no white gynecologist in the United States of America because of litigation. Because for every pregnancy, every pregnant woman, there is a hungry lawyer outside. I don't say lawyers are hungry. Let somebody here who is a lawyer now say that, Dr. Dawson. So, Doctor, there are no experienced gynecologists. It is so, all right. Ask, does the hospital have a blood bank? Does the hospital have an anesthesiologist? But more importantly, does the hospital have a pediatrician? All right. There are some hospitals you should not deliver in. And for those of you who are going to be delivering outside the country, please immediately you return. Come for some immunization. 3 more issues. No child dies in your womb at once. The child will give you 24-hour notice. When you come for antenatal. 24-hour notice. So after the 28th week of pregnancy, all pregnant women should do what we call a fetal kick chart. Your doctors will tell you what it is. To the questions you asked, are additional supplements necessary? Don't worry, just eat well and take pregnant care. That's enough for you. What complications should prompt a doctor to call a woman? All complications should prompt a pregnant woman to come to the hospital. Don't come here. Because when you are bleeding, come to the hospital. When you are leaking water, come to the hospital. When you feel like fainting, please come to the hospital. When you are having bleeding from your nose, come to the hospital. When you are having cramp-like abdominal pain, come to the hospital. When you are having backache at the lower point, please come to the hospital. When you suddenly discover that your hands are weak and you can no longer hold things well, come to the hospital. If I come to the hospital every time, after all, you are paid for antenatal. Whether you come once or you come 4 times, antenatal fee is the same. So come. What is the effect of epidural management? Another doctor will take that question. All right. Now, purging in pregnancy. When you purge in pregnancy, if it is early pregnancy, you are likely going to have a miscarriage. But if it is later in pregnancy, it may start labor. The reason is because the intestine is behind the womb. So as the intestine is getting irritated, it's also irritating your womb, making delivery to be imminent. I want to thank you all for allowing us care for you, and like I always say, giving us the opportunity to be in your home. For those of you who didn't come with your husbands, go and tell your husbands at home that our commitment to you and our pledge of service is that we're going to use the antenatal care phenomenon as a preventive medicine tool and device to make sure after pregnancy you return back to your pre-pregnancy state and have the capacity to deliver again if you so desire. That's our pledge. That's our promise. By the grace of God, we will deliver. I want to thank you all. Did I answer all your questions?
Thank you very much, sir, for that very elaborate topic and discussion on preventive medicine. He has touched almost every aspect of medicine. Just for the question of epidural is extremely safe. We do it here. We'll bring an anesthetist. We took a delivery this morning. We did one yesterday. That one was the cesarean section. But the woman was shouting, was all over the place. By 5:30, we started over the night and ended up with delivery around a few minutes after 8 this morning. Finally, when we put epidural, she just calmed down. She doesn't even know. The baby was sitting on the head of the baby. I just told her, your baby is already coming, madam. Just push. She was as calm. She didn't even know. Epidural is extremely safe and is highly, I say highly recommended. If you think you can bear it, just come with your husband. Tell him to wear his shirt that he can tear easily when you grab him. The epidural is safe. For the past 17 years that I've been with Dr. Dawsa, 15, 17 years, epidural is safe. In the teaching hospital in those days, we only hear about it. It's in the books. We have it. It's only when the governor's wife is coming to deliver or some top students. It is readily available. Just 100,000. Why do you want to come and shout and tear everybody's dress? When you go to a delivery, it's delivery suit. It's not the labor room. You are not here to labor. God has given a solution to it. We'll bring Dr. Form or Dr. Igwe to come and talk to you again about epidural. It is extremely safe and there are hardly any complications. So I want to thank you again for coming. A lot of you say you don't receive our invitations either by email or by text messages. Make sure you drop your number. The coordinator of this program is in the SALT office, but you don't need to even see her. If you drop, once you have registered for Antenatal, it is already captured. The EMR has a way of identifying you and you will receive our email or our text messages. But to make things easier, there are flyers, maybe they may be around at the end there. If they are not, if you come to each of our consulting rooms, you can pick one there. For the whole year, we have printed all the days. That's why we couldn't even change this one like the same they have said. So these flyers are available. Just pick it to know each of our classes. They are 11 a.m. And during the invitation, everybody was can you start coming forward? All those invitations will tell you come with your spouses. Dr. Dawsa has taught us so much about the grandmothers and the both on both sides, either on the mother's side or the in-laws. Come with them if possible, so that we can empower you. Once more, at the beginning, Dr. Dawsa has also mentioned it to you. We are sorry we have to do these classes, but I can see a sizable number of our Muslim Ummah friends here. Once more, I want to say Happy Salah to you. And we want to, let's put our hands together for Dr. Akande for a great lecture. Let's thank Dr. Dawsa also for a great contribution. Head nurse and our team for being around. Head nurse will be waiting for you. Some of you will be delivering before the 6th of May. Just make sure you wait behind and see head nurse for the last lecture, extramural class. She will tell you what to do. If you want to also go and see our delivery room, she can arrange to see. You want to see our room, she wants to see our rooms, she will arrange and see. You want to see on our presidential suite, which is very, very cheap. You can stay there. And of course, Dr. Cynthia, our chief resident, is also here with us. We want to thank her. She's always very available. Like Dr. Dawsa has said, just come to the hospital. Don't bother to even call us. Don't text message. There are competent doctors led by Dr. Cynthia that are always available to listen to you and call us if we need to come to the hospital. Thank you for coming. God bless you. Let's be on our feet.
Concerning this breastfeeding, I think we need to teach people how to breastfeed and how to bath their babies. Can we do that next time? Okay, the next antenatal class, we will teach you how to breastfeed and how to bath your babies. So, please come with your mother, your grandmother, and your husbands. We will teach you certain things that they are doing to your babies when they are bathing him or her that your husband should say no. Like when they were bathing me, my grandmother turned me upside down, and that's why I'm not afraid of height. They threw me like this and they grabbed me. That's why I'm very courageous. But that is what has also killed many babies. Your own baby should not die. I beg you, come with your husband. Have you ever seen a man trying to bath a baby? Oh God. You will know that man is different from woman. Let the baby cry. You will see the way we hold. But we need to teach our husbands how to bath babies. It doesn't mean you are weak. It only means that you are strong and you are a good husband. That's what we're going to do in 2 weeks' time. So it will be a great meeting.
Thank you, sir, for that addition. Please plead with us to be on our feet in honor to our DIFF anthem and to the national anthem, which is a prayer. We'll take the second stanza of Nigerian national anthem. But first stanza of DIFF anthem, second stanza of national anthem. Then first stanza of DIFF anthem, second stanza of national anthem.
Together bringing hope for the joy of mankind, committed to excellence, oh man.